Thank you very much, Dr. Saji Kudiat Borges. I've been there on your platform once, few
Yes, yes,
months back.
yes, yes, yes.
I'm very happy. My friends, a very good evening. Some of you, midnight. I have been working for last so many months only on the COVID. So let's start the session. Can you make me the host or share the slides? We can do that.
Yeah, please make a co-host, Dr. Jawahar Shah. You are already a co-host, Doctor.
Okay, great. And sound. Make the sound first. Sound.
You are audible. You
Yeah,
can.
yeah. No. Even there will be a slide which will have a sound, right?
Okay, okay. Yeah, yeah, yeah.
So just start with the presentation, please. Okay. So, friends, a very good evening, and this is what it is. We have to fight against the COVID, and this has been my journey. As Dr. Saji Kudiat said it well, we have distributed 1.2 million immunity boosting kits, and the results have been amazing. Today, the lecture is going to be divided upon my experience in the initial phase, why we distributed immunity kit, and what was the outcome. Second part would be the new app which we are going to release, which we want to give it to all of you. And the third part will be practical, simple application of homeopathic medicines. And you will see I have selected the cases with a wide range. So that is what I wish to do today. In last 12 months, I've been working practically from 3 or 4 in the morning till 9 or 10 every day, 16 to 18 hours, all 365 days. In last 365 days, I have taken holiday only for 15 days. What is the biggest crisis in Corona? The oxygen. Right from our birth, we have taken oxygen absolutely free. Have you shown even one courtesy, one gratitude towards the nature which has delivered it free? It is our time that all of us give it back to the society. All our COVID warriors or our physicians should get charged up and now do something about it. And that's what I took it as a mission. In last 45 years journey, I have treated more than 13,000 cases of bronchial asthma. Now, why I'm sharing this? Because it gave me an experience how to manage chest conditions. We have treated more than 13,000 cases and created a special repertoire on bronchial asthma. With this experience, I have taken it further, and recently we have created a separate COVID repertoire which we are going to release by the end of this month. It's a beautiful repertoire and a auto recording system with the symptoms. It will be of a great use. Now, you can attend this webinar absolutely free. It's a 2-session webinar. You can note down this link, bit to do asthma webinar, and you will learn lots of things about bronchial asthma. Okay. Now, homeopathy has been effective, very effective in past epidemics of cholera, influenza, Japanese encephalitis, and produced very encouraging results. And I'll start with the Dharavi story. Dharavi is the biggest slum of Asia, and you'll be surprised. It was a ticking bomb. There is a population of 6 lakh 50,000 people in a small 2.5 square kilometer area. So just imagine 2,27,000 people staying in a kilometer area. There was not proper sanitization. There was no proper facility. The whole place was so crowded, common toilets being used, and the risk was very high. So in the last time, it was big problem. Okay. And now I'll start. What is the truth? Truth is that it takes 7 days minimum to develop the immunity. Whatever people may say, you may give any of the medicine, any of the things. And the learning was that you need minimum 3 doses, 3 times in a day for 3 days. Now, here came my experience of everybody gave arsenic alb. Even CCRH, every senior person recommended arsenic alb. But here my experience came to help because there were a lot of cases, arsenic alb is chilly, and a lot of cases were feeling hot. Now, arsenic alb does not cover, and it was very difficult for a mass to differentiate who is hot, who is chilly. So we found out the solution. We said 3 days arsenic alb and 3 times in a day. See, please imagine, if we have to take food once in a day, are we happy? No. So if we have to boost the immunity, we must give at least 3 doses in a day and for 3 days. So what we did was arsenic alb 30 was given 3 times in a day, followed by arsenic iodide 6, 3 pills, 3 times in a day. And we have seen that it reduces the congestion, it reduces the inflammation and infection, and it really worked as a immunity booster. It gave fantastic results, and we bought 12,000 bottles of 100 ml dilution and 11 tons of pills, and we gave it away absolutely free to most of the population. We reached to 1.2 million people, and they were given, and some of the people who insisted because of the government notifications, they didn't want to go again, we gave arsenic alb only. What was the population we reached? We reached to the governor of Maharashtra, mayor of Bombay, inspector general of Maharashtra, and the entire police force was covered. We gave it to doctors, nurses, and paramedical staff. Mumbai Police Force, National Highway Traffic Police Force across the entire Maharashtra. Krishna Prakash ji was the IG admin and he supported us. National Disaster Force, Ministry of Affairs, External Affairs, Government of India, Bombay Municipality Warriors, fruit vendors and vegetables, slum area and thickly populated areas, press people, press reporters, media professionals, firefighters, fire security force, local citizens, NGOs, corporate organizations, and the number is unlimited. What most beautiful experiences which we had were very interesting. Some of the media people who never believed in, there was a meeting and there were some 62 people. Out of that, 56 took the kit. 6 people say, we don't believe in homeopathy. Homeopathy is all useless. And you'll be surprised that those 56 did not have COVID. The remaining 6 suffered from COVID. There was a special security force which was for the VIP people, and there were 400 plus people in that VIP security, including the CM and all the ministers and everybody. Now this 400 group was specially requested to take this medicine both alternately, and to our surprise, they were getting exposed to people every day. Different kind of people, they had to look after the security, and only 6 of them suffered from COVID. even in the Santa Cruz police station where I stay, nearly about 250 people were given our immunity medicine and only 3 or 4 suffered from COVID. So that is a proof that it worked. In fact, Maharashtra, Krishna Prakash ji gave a certificate that, of the work which we have done. He acknowledged. You can see here, we used to give properly packed and see the immunity kit being distributed. It was not just, small plastic pouches we gave. We gave properly packed medicine. And what was the impact in the slum? There were a lot of NGOs, a lot of organizations which were involved. Dharavi, which was a slum epicenter, in a small place of 10 by 10, 5 people stay, 2-3 dogs, 1-2 cats, 2-3 hens, and still became an epicenter. All the roads towards Dharavi were blocked. We distributed, okay, nearly reached to 4 lakh people. And a lot of other organizations also helped. And from hotspot, what happened? By June, the number dropped down to single digit in that area. Now, this is the impact of homeopathy. And, in the last meeting, which we had COVID Maharashtra Task Force, everybody is asking, why this time there is so much of suffering, so many people suffering? The logic is simple. I said that, please note, last time everybody used Ayush medicine. I would not say only homeopathy. They used some of the kadas, some of the things, and it worked. This time there is no air about preventive. And you can see the result. Largest number of people are suffering. This is what happens when you don't follow. We have to come together to help people. Human being is very complex, and so is corona. So we have to be absolutely clear, connected, and committed to relieve. You can see the governor of Maharashtra, Mayor of Bombay receiving. So it's not something. And see, the Chief Commissioner of Income Tax, we gave them 7,500 immunity kits, and he was so happy. He was so happy because all the family members were taken care. The Maharashtra fire services, they were so happy. They said we were totally neglected. Nobody even bothered. Nobody bothered to give us. And we were the first organization who gave. And the same thing was continued, given to doctors, nurses of the National Disaster Team, Government of India. And see what she has to say.
In the last 3 months of COVID-19, I have been working day in and day out along with a staff of 40 people, and all of us took homeopathic medicines. We all were exposed to a floating people of 100 to 200, various people from hospitals as well as wards. And I'm really happy to say that none of us actually got any symptoms, and we all are hale and hearty.
See, a doctor saying that, and they were getting exposed to 400 people every day, 200, 300, 400, different kinds of people. And you never know who is suffering, who is not suffering. And those people did not. So, what do we have to say? Sometimes a picture speaks more than 1,000 words. What is the result of the immunity boosting kit? The random survey showed that less than 1% of the people suffered from COVID, and those who suffered, most of them were asymptomatic. The CT count was acceptable count. They recovered very fast. They did not have any side effects or complication, and most of them did not travel from asymptomatic to mild to moderate. They did not go into complications, even though some of them had comorbidities like diabetes, blood pressure, and some of them were even organ transplant people, they did not suffer. So less than 1% random survey. Okay. So the next step we should thought, I said, this encouraged me to take up a next step. And my friends, I need support from all of you in this matter. We came up with an app which is Hilti, COVID Care and Beyond. What does it do? It is a bridge between the physician and patient. You can treat the patient and get treated from the comfort of your home. And what is the advantage? And see how beautifully the mascot has been designed. If you see at the base, you can see yoga. If you see in between the Ayurvedic and Unani, if you see allopathic, and of course homeopathy is there on the top, because it takes care of mind, it takes care of body. So this particular COVID app via telemedicine consultation, that is from the comfort of your home, you can use homeopathy, Ayurvedic, allopathic, yoga and Unani medicines. So this is the contribution I thought, and I have a desire to give this absolutely complimentary to one and all across the globe. And Dr. Saji Kudiat is planning a mission. He is planning for a mission, and we will definitely support. I mean, at the end of the session, he's going to talk about such a wonderful thing which he has visualized. He said, all of us get united and fight for the cause. What does it do? Treatment near you, experienced doctors, and accurate COVID treatment. Way is right way, holistic way, or integrative way, and you can choose one individual form of treatment or permutations and combinations. So you can choose one or go for an integrative way. Okay, and you can have online video, audio, chat consultation, and every line of it, the digital case record and prescriptions will be saved in your app. So stay local, treat global. That's the mantra of today. And this will be available hopefully by 25th or at least latest by 31st. And you can download this app, share it with your friend, share it with your colleague. The purpose is to create a healthy, harmonious homeopathic world. So after sharing what was my experience in preventive aspect, carried this experience to actual result-oriented app, we go to the cases. This was my first case. It was very interesting phenomena which happened during these 12 months. There were cases which would respond only to acute medicine. There are cases who would respond to acute but require some constitutional medicine. And there were cases which would respond very well to the intercurrent or antimiasmatic medicines. And all these medicines, friends, expressed in the different way. And when they were prescribed in the correct phase, they gave the result. I'm not going to talk about rare medicines like bamboo or some scorpion or some, rabbit hair. I'm sorry, I don't use those medicines. Homeopathy is simple, and that's all I want to share. Homeopathy is not that complicated what we make out of it. Even though multiple patients from the same family tested positive, and this is what I share with my allopathic friends, their presentation of the symptoms, was different in all the different individuals. I said, friends, now how do you do that? Recently, I was referred by MUHS Vice Chancellor a case in Nashik. The patient was breathless, absolutely breathless, even after 4 or 5 weeks of treatment. The patient was not turning negative. And the vice chancellor says, can you help me? The patient is suffering from COVID for last 4 weeks, was on oxygen, continuous oxygen. We treated him for 2 weeks. And just yesterday, the daughter called me up and said, he has completely recovered. He is moving around in the house without oxygen help, without anything. He's able to do his work normally. And she referred one more case from another far off place, that is Amravati. So this is what happens, okay? And what did we observe? Each one of them had a different pace, different speed at which the disease developed and progressed. And some of them remained asymptomatic. Some of them developed mild to moderate symptoms, while some developed severe form of illness. Same family, same thing. And this is what we are seeing today. The difference in the disease presentation calls for different homeopathic medicines to match the pace and the expression of the disease. This proves the homeopathic concept, choosing the simillimum based on individualizing symptoms. Just like human fingerprints, just like iris, it's not same, differentiates their identity. Same way, like fingerprints, you have remedies which too are different with their own unique traits, expressions, and the speed. In the acute cases, most of the acute cases, indicated medicine helped immediately. If started early, it gave good result. So this was my observation, that if it started good early, it gave a good result. Whatever may be the stage, but the patient in early stage were responding very well. Another phenomena which was observed, that if one member got, other members automatically would get, and they would have a wide variety. There was a home in which we had 6 patients, and in all the 6 of them, intensity was different, medicines were different, recovery time was different. Even with the low vitality and comorbidities, we have helped the patient to recover completely. Transmission within the family is very, very high. Although some of them may not be affected. So this is only a rare phenomena. And some of these cases, differentiation of the remedy was a very, very difficult thing. Most of these cases were evaluated twice in a day, but we are not going to show you all the follow-ups because some of the follow-ups were uneventful. So otherwise it will take only one case we will be able to, and most of the cases were completely taken for the learning purpose. We are sharing the key features or key expressions of that case on which the prescription was based. We start with my first case. He was a young boy of 21 years old. He came hardly any symptoms, absolutely normal in functionality. He had initial symptoms of loss of taste, loss of smell, mild throat irritation, and he said completely, I am fine. During the history taking, everything you ask, I am fine. I have no symptoms. I have no symptoms. But only thing which he had was loss of taste and loss of smell. Here you can see COVID is positive, detected. Okay. And what are the symptoms we are taking? Delusion that I am well, says I am fine, loss of smell and loss of taste. Simple. And repetition gave the remedy arnica, and we all know it so well. even when the patient is sick with complaint, he will say, I am fine. And I've used this medicine very frequently in a lot of cases with fever. Right from my college days, I have observed this. There were children who will have 105 degrees temperature. If you touch, the body is absolutely hot like a fire. But very important, they are playing. They are playing. Children will not say that I'm fine or I have no symptoms. They are playing. But when you touch, when you put the thermometer, you get 105 degrees, and that is arnica. So in this patient also arnica was given. You can see he is well. The prescription was arnica 200 4 times in a day. On the third day, sense of smell came. On the eighth day, the patient tasted negative. And the father, this family owns a big manufacturing unit of allopathic medicine. He never believed in homeopathy. He never believed in homeopathy. And see what he has to say. Listen from his mouth.
My son had lost his sense of taste and smell. He was not having any other symptoms. No fever, no cough, no cold, no breathlessness. We went to a specialist and he insisted us to go for the COVID-19 test. And to our surprise, he tested positive. And this scared the hell out of us. But then came to our rescue Dr. Jawahar Shah with his homeopathy medicines. We are not strong believers of homeopathy, but nevertheless gave it a try. And believe me, right from day one, there was some improvement in his lost taste and smell. And within 3 days, it was restored to a great extent. His test report turned negative after a week.
Now, friends, see, and they are non-believers. And their 3 or 4 generations had been manufacturing allopathic medicine. And trust me, in spite of his son completely recovering till date, in 1 year, he has not even referred me one COVID case. This is how people are. People work with so much of paradigms. Every time when he meets me or calls me, he said, I'm thankful and this and that, but not even one case. And that is what is the blinders on our eyes. A homeopathic physician doesn't get that much credit. You must understand. We must get united. The biggest problem is that we are not united. And I'm happy that Dr. Saji Kudiat and his team is doing excellent work. It's not easy to continue working day and night and with little help around, because I know position in Philippines, with little help around, he has been able to continue for last 229 days. The total of today is 229 days. And as when we play, housey, we say 13 numbers. And when we announce, we say lucky for some and unlucky for others. Same way, if you total it, the 229, it comes to 13. So it's lucky for me. Learning. What is the learning? Prescription is based on the limited data. Appreciation on the importance of mental symptoms in pathologically advanced case. Selection of the potency 200 because both vitality and immunity of the young man is good and the relief happened in a short period of time. So that's a learning process. We go to the next case. A president of a multinational company was down with COVID positive. Hardly any symptoms, started with body pain, fever, took paracetamol. But after 3 days, he got fever. Temperature used to go to 102. Again 2 days, no fever, again fever. And this kept on changing. Cough and cold since 4 or 5 days. Expectoration, which was yellowish. Feels hot most of the time, needs AC. Thirst for large quantity at a time. Takes 4 liters in a day. Perspiration profuse, appetite reduced. And the mind, here the mind is very important if you observe. Feels lonely. What happened in this case? By that time, the hospitals were full. So there were a lot of hotels who opened out. And he was quarantined in one of the hotels. Feels lonely, desire to go home, working from the hotel room, enjoys working. See, now this is a very characteristic symptom. Although he's down with COVID, he's got cough, chest, congestion, but he wants to work. Very short-tempered, violent, abusive with anger, throws things in anger, aggravated by consolation. He doesn't like consolation. Does not listen, wants to be alone at that time. When he's angry, he doesn't want. Fear of disease, trembling in stomach area. See, however you may be, rich, vice president, president, the disease is something which scares you. And that is why he could not sleep. Dreams of ghosts, scary dreams. Feels that there is somebody around him, gets hurt very easily. He could not sleep. Okay, and he would get up suddenly with jerk. You can see here the reports are COVID positive detected. We took the totality of the symptom which was pertaining to the acuteness. Thinking of business, work desire, body ache, headache, thirst for large quantity of water, loss of smell, loss of taste. Okay, and what happens? The remedy is very simple. Thinking of business, although he was, the remedy comes very clearly, bryonia. And here you will see the difference. Bryonia was given 200, 2 pills, 6 hourly. Follow up, within 3 days, the fever, throat pain, everything disappeared. Mild throat pain. Patient was continued. Oxygen kept on fluctuating. So in 2 days, you can see the difference. On the 7th day, symptoms completely subsided and the test report came negative. Patient could go home. So he could go home. Now what happens? The story doesn't end here. Acute phase was over. So we must treat it with a constitutional medicine. Anger suppressed, violent and aggressive. And all of you know the remedy. He used to throw things and the remedy is staphysagria. So after bryonia, the patient was having a lot of lung congestion. We thought that there should not be post-COVID complications. The patient was given staphysagria 31 doses every night for 3 nights in a week for 1 month. So totally 12 doses were given. Patient reported that he is feeling much better. He said, even before the sickness, I could not have this kind of energy level. My energy level has completely changed and oxygen level became 99%. And he started cycling every day 12 to 15 kilometers. And those who have been handling such cases know it well that post-COVID emphysema, post-COVID bronchitis, post-COVID complications are there. And the patient completely recovered without any problem. And today also that patient is wonderfully cycling, exercising, doing his job perfectly. And see what he has to say.
I would like to thank Dr. Jawahar Shah for helping me during my COVID phase. As soon as Dr. Jawahar Shah came to know that I have been tested positive, he told me not to worry and asked his assistant to call me and take all my personal details and other medical history so that they could develop the medicine to give me. And within 2 days after the interaction with Dr. Jawahar Shah, they sent me a kit with all the medicines which helped me get out of corona and get negative again.
What do we learn? The acute medicine cleared off the COVID-19 in a limited period of time, but the constitutional medicine improved the vitality of the patients and gave the energy to work cycle for 15 kilometers. So whenever the acute phase passes, preferably keep your constitutional medicine ready so that there are no complications, there are no remnants of COVID-19 which remains. This case allows us to learn a very interesting process that all the complications can be prevented if the help of the homeopathic physician is taken. You may treat this patient with anything which you like. At the end of recovery, hand over these patients to homeopathic physicians and you'll have less chances, less complications, and less problems in the patient's life. But who has to give the message? All of us have to get united. The biggest problem of homeopaths, we are not united. We go to the next case. This is a very, very interesting case. The case was only on dialysis. He had a kidney failure. He was the assistant commissioner of the police with VIP securities and everything, who was heading a VIP securities. He was admitted in the hospital and the COVID test was remaining remaining positive. He was continuously on dialysis and you'll be surprised. Then I received a call one of the days from the, IG's office that we need this officer to be treated. You can see it was all the time positive. Okay. And here came a beautiful incident. When I took the history, the patient said that I have no symptoms. And we know Arnika says nothing is ailing, no complaints, severe soreness, bruisedness, physically restless but mentally prostrated. Bed feels hard, foul breath and discharge. Okay, but he had this particular patient, like any other patient, had no symptoms. And what we did, the prescription was Arnica 200, 2 pills 4 hourly. And Thuja 200, 3 doses at bedtime. Why Thuja? I have observed this very, very important, that there is an obstinate case. It's a psychotic expression, not responding to conventional medicine, not responding to any treatment which was given, and not even getting worse. That is a typical psychotic expression, fixity, paucity of the symptoms. The patient was given Thuja 200, 3 doses, followed by Arnica, and the patient kept on improving. You will see the follow-up. Arnica was given 4 hourly, Thuja 200, 3 doses, patient much better. In 7 days, you see, and the patient was put on SL. On 29th, the patient tested negative. So a patient who was suffering for 3 weeks practically became negative with the help of correct treatment. And you can see, not detected. Learning, appreciating the phase of the patient and need of the intercurrent medicine, antimiasmatic medicine. The patient was not responding to the treatment. That shows very clearly the phase, the base, and the expression was psychotic. Although we know that his kidneys were suffering, He was under dialysis, means it is out and out syphilitic expression. But still, the patient's mental state, the emotional state, the expressions were still psychotic. Introducing Thuja, the body became susceptible to arnica, and there was a gradual reversal of pathology, leading to reports being COVID negative. The patient could have gone into complications, but with the help of homeopathy, no complication, and the recovery was complete. And see what he has to say.
नमस्कार. मी प्रमोद कदम, माजी सहाय्यक पोलीस आयुक्त संरक्षण शाखा मुंबई. मी संरक्षण शाखेत कार्यरत असताना लोकसंपर्कामुळे कोरोना पॉझिटिव्ह झालो.
You can see
कोरोना
contact
पॉझिटिव्ह झाल्यावर
corona positive.
मला सेव्हन्थ हॉस्पिटल रिलायन्स फाउंडेशनच्या ॲडमिट करण्यात आले. त्यावेळी अंधेरीचे होमिओपॅथी डॉक्टर श्री जवाहर शाह यांनी माझ्याशी संपर्क साधून माझी मेडिकल हिस्ट्री घेऊन त्याप्रमाणे मला मेडिकल किट उपलब्ध करून दिलं. त्या किटमुळे मी लवकर बरा होण्यास मदत झाली. तसेच त्यांनी माझ्या फॅमिलीला कोरोनाचा त्रास होऊ नये म्हणून होमिओपॅथीचे मेडिकल किट उपलब्ध करून दिले. त्यामुळे माझी फॅमिली माझ्या संपर्कात असून सुद्धा कोरोना पॉझिटिव्ह झाली नाही. त्यांच्या या मेडिकल हेल्पबद्दल मी त्यांचे आभार मानतो. थँक्यू.
What he said, I was in touch with my family. Still, my family did not suffer because of the preventive medicine which was given. Friends, this is the power of homeopathy. If we get united, the world will change. Please. Another case, very interesting case. Now, this was a very, very interesting case of a little child. It was a 1-month-old baby. Patient presented with complaint of vomiting, nose block since 2 days. And 5 of the family members were already COVID positive. Birth weight was 2.69 and had jaundice at birth. Now see how a small history can make a lot of difference. In 1 month, he has become 4.2 kg. Patient was sweating a lot, hot thermally. He had a lot of cough, cold and wheezing. The patient was seen by pediatrician. Now here where the differences came into the picture. Pediatrician says don't get the child tested for COVID. 1 month child cannot have COVID. I don't know. I felt that this particular child has got COVID. I insisted. There was a lot of discussions on this matter, lot of arguments. I said, please, if you trust even one person, what do you lose? What do you lose in that? What do you lose? Nothing. You're not going to lose anything. Just get the test done. And in those days, it was a bit expensive. So all the family members would think 10 times before getting it done. But then I insisted, the test was done and it was detected positive. Now just 1 month old child. What was the symptom taken up? Jaundice at birth, better in propped up position, cough with wheezing, vomiting, nose block and heart patient. But if you see, there's one particular rubric, jaundice in newborn is natrum sulph. And in my 45 years of practice, I have seen lots of cases when you cannot find the constitutional medicine, when the symptoms are in paucity, and if the family members say that the child had jaundice at birth, you give Natrum Sulph, it works beautifully. Here you will see something very interesting. The patient was prescribed Natrum Sulph 6C. Now, with a strong history, but the mother did not give the medicine. Okay. The other remedy which was thought was arsenic iodide 6C because the patient was very hot. It was a lot of congestion, breathlessness. So the patient was prescribed Natrum Sulph 6C and arsenic iodide acute medicine. The mother did not listen, did not give any medicine. Suddenly, the child's oxygen dropped to 85%. She calls me and asks, what do I do? I said, start the medicine arsenic iodide 6C every 15 minutes. The child was breathless with fever, congestion in the chest. The pediatrician advised that they put the child in full AC, cold sponging, and hospitalization, to which I refused. I said, please don't put on AC, don't do cold sponging, because the child is already in a bad shape. The body will go through a shock. He will surely develop pneumonia changes and other complications. Fortunately, she was wise enough to listen to me. I asked her to cover it properly, continue iodide 6C every 1 hourly, keep her checked on the pulse and oxygen. In 6 hours, the oxygen rose to 91. In 12 hours, it touched 96 and the child started recovering. Today, both mother and child are normal with no complication, no chest congestion, no nose block, no COVID. Here you can see the test negative. What is the learning? Physician has to be alert and vigilant. Okay, physician has to be alert and vigilant. He doesn't have to be vegetable. You know, just somebody presses you, somebody tries to force you and you listen. No, you go by your conscience, you go by your clinical judgment, you go by your knowledge and experience, and your judgment will always turn out to be true. So in this case, if we had not got the test done, the disease would have progressed and we don't know, it would have gone to the critical stage. So we have to treat such cases with a lot of wisdom. If the child was put on AC, he would have been with lots of complications. And SpO2 going down suddenly, that means the pathology was progressing at a very high speed. Selection of the acute medicine followed by timely case taking are followed by from 95 to 85 to 96 in a very short span of 12 hours. That means medicine was right. It was followed by a constitutional Natrum Sulph, no hospitalization, no complication, and the child is always giggling and happy, recovered completely. And see what she has to say.
I delivered on 9th of June, and unfortunately, I was detected with COVID-19 virus, me and my baby, both of us. And for this entire situation and how to go ahead, Jawahar sir was the only one who was guiding us, and I completely followed whatever he said. And he's really saved me and my baby and my husband also, for that matter. Before even getting tested for COVID, he was pretty sure with the symptoms that Subhashri, this is it, this is what is going to happen. And you know, exactly it was happening the same way what he was saying. So I really trust him when it comes to medical guidance, and I would suggest that anybody who's coming across such situations should go for this welcome cure homeopathy kit that he's suggesting, because it has really helped me, my baby and my family to get saved.
So now here is the mother who was down with COVID. We have treated 4, 4, 6, 6, 8, 8 members in the family. So 10, 7, 20, the father tested positive. Father, sister, mother, everybody was positive, and they had to be admitted in the hospital. She had to leave the parents' home, went to in-laws' place. And as she said, 9th was my birthday. 9th June was my birthday. And we started treating all these cases. And you know the report and the arguments. I don't want to go into the details. And here she also turned positive. Mother started having fever on 7th July with itching, irritation in the throat. She felt better with hot water. She had no cough, no cold, no change or taste smell. She could not breathe since a day. She had too much of sweat, feeling very hot, drank 7 to 8 mugs of hot water, had severe body pain with lot of anxiety, totality of the symptom, stool aggravated by anxiety, body pain, pain in bones during fever, ameliorated by warm drink and breathlessness. And see, sometimes we get fixed to the idea that only these medicines work. And that is why I've taken up this case. And what was the remedy? Eupatorium perfoliatum. I was shocked. I never imagined Eupatorium perfoliatum in a COVID case. And you can see how beautifully Eupatorium perfoliatum gets covered in the fever, the totality, the extremities, the body pain. And this remedy I've used in quite a few cases of fever where nothing is indicated. You give Eupatorium and the patient feels better. The patient was given Eupatorium perfoliatum 30, 2 pills every 4 hourly. And see the follow-up. No complaints. Within 2 days, the patient started feeling better. The oxygen went up. Everything was normal. The report was tested. So, strong homeopathic point of view. This supports the strong homeopathic point of view. The diagnosis is important to a certain extent. Eliminating common symptoms, knowing the prognosis. Diagnosis is very important, I say. Eliminating common symptoms, knowing the prognosis, potency selection and repetition, and managing the follow-up irrespective of the diagnosis in cases. When it comes to the prescription, final prescription is always unique to that case, and this uniqueness gives a very, very quick relief. Even if the case has a lot of complications, I have many cases in my bag, but I'm sharing only few with a different range. And friends, trust me, this has given us a lot of positive experience, lot of learning has occurred, lot of things which have happened which we realize now when you go through this difficult time, you actually know who is close to you and who pretends that they are close and they are not close to you in reality. We have helped hundreds of patients, relieved them to a great extent, given them a comfortable life, a quality life. And these are the people who say very strongly about homeopathy. Nowadays, with the big surge which has happened, we are getting 10 to 15 COVID cases every day. And fortunately, in last few weeks, I must have received more than 100 cases, and only one case required hospitalization, and that also he recovered within 3 days. Friends, if you have any questions, please feel free to ask. Note down my email ID. If you have anything to be shared, feel free to share. I'm thankful to the organization. I'm thankful to every member who has been present here, you know, in watching the Indian Idol or Anupama serial would have been a choice, or using the Netflix Hotstar. No, you chose the hot topic, that is COVID, to be present here. So I'm thankful to all of you. I'm thankful to the team, Dr. Saji Kudyat. Once again, wishing you great success in your beautiful journey, and I'm sure you'll be able to complete 267 very easily. And that's the day we'll celebrate it again together. Thank you very much.